I'm Tony Regisford, and this is Unrendered. I'm chatting with Dr. Donna Brown. She's here with the World Pediatric Project. Dr. Brown, we went out with that question, just sort of positioning the facility we have here, comparing it maybe to what else exists out there in the world. How would you position that, the facility itself?
The facility itself is always going to have ways to improve. That's going to be true, I think, in any country of the size such as St. Vincent and the Grenadines. When you have a small population, that tax structure is such that you have a certain number of dollars, and with those dollars you have to do education, health, the roads, security, police force, etc. So I think there's going to always be room for improvement in any facility. There's going to be maintenance, there's going to be new needs, there's going to be, we need a new CT scan, or we need something or other, so there's always going to be
Health is particularly expensive.
Yes, and you know, healthcare is incredibly expensive. I mean, you look at the challenges we face in the United States in keeping our facilities, and there's always new technology, there's always some new thing that's going to be better than the last, and I think we all struggle with the healthcare dollars. It is so, you could spend all of the money you get from your tax base on that facility and still not have every single thing you need. I think for the size of this country, this healthcare facility is what it should be at this point. Could it improve? Of course. I think the thing that is world class is some of the people there, and some of the people that are really trying to make that hospital and in general healthcare, the district clinics, etc. And just the programs. Again, I think it's all about the people and the programs, and you can do things in a facility if you have the people in the programs who are dedicated to figuring out how to make things work. I mean, you look at really how we started working here. You have a pediatrician who says, I'm not getting what I need, my babies are dying from heart disease, help me please. And we say, well, we can help with that, and they say, okay, and she figures out how to make that happen. I had a long conversation with the CMO yesterday, Dr. Keyser, and about the programs for ophthalmology. We now have 4 ophthalmologists here, and a few years ago we had none. And she told me of the concepts that she has for making sure the diabetics and the hypertensives get their exams, and how we use the ophthalmologist here to continue to take care of children when I'm not here. We were able to get an operating microscope, which we needed desperately a few years ago. And we didn't get that from the money from the government. We got that somewhere else. So do you depend on gifts? Do you depend on grants? You depend on somebody believing in you and knowing that you have a program that's going to work, and they'll invest their dollars. If you have something that is not likely to work, you're going to have people that are savvy saying, I'm stepping away from this until I see better. So I think the things that encourage me when I'm here is that I see things like the pediatric wing happening, and I know that somebody observed, somebody who's a savvy businessman came and said, yes, this is going to work. We believe in what World Pediatric Project is doing here, because with that we have full, complete pediatric care. Because we have the subspecialties now. And with that, we need a facility that will match that. So as the programs get better, as the people who are Vincentian come back here to practice and care about the health care of their fellow citizens, you're going to see the demand for improvement in facilities, and then the government is going to be required to figure out how to do that, whether it be to ask another country to help us out and give us some money or grants, etc.
So let's look at economies of scale, because you identifying the challenge of population size and how do you attract people that are top of their game in the particular medical fields to cater for the needs of a small group of people. So your concept of having this hub here in St. Vincent for the pediatric care of the Eastern Caribbean, those with special needs that are not provided necessarily in the islands that they're from. Could we extend that sort of concept, and I'm just throwing this out to you, to the rest of the healthcare across the Caribbean? And I'm talking about centers of excellence, right? So, you've got a bigger population, obviously, if you add up all the islands. Perhaps still not as big as one single state in the United States, but sizable. And do you see that hub concept for special areas of care working in different posts, different islands? So for cardiology, or for neurology, or that sort of thing. So one specializes and not tries to be too comprehensive.
I definitely think that's the one of the highest chances of success would be a program such as you just described. In fact, as we were looking at the hub concept, we entertained the idea, could different countries be a hub of something? Should a center of excellence for cardiology, for example, be in one spot? And so I think the fact that the OECS is looking at that and gathered their ministers of health together in a conference and are trying to say, how can we cooperate together? If you get a group of countries that are cooperating on other issues, why could they not cooperate with health? And again, if you can attract the practitioner who knows how to, who one is an exceptional practitioner, physician, surgeon, and knows how to work towards getting a program, and that is their goal and their passion, then you can do that, and then patients can go there. So I think that is one significant way that you could solve these problems. In fact, often we've said, if we prove that this can be done with pediatrics, that's just the first step in elevating the entire
so that's a model that you can use
for the whole country and for the whole region, and that's really our goal and our passion. We've got this idea that we could really make a difference and make pediatric healthcare awesome, and then maybe that also the next step, somebody's going to take on that charge of trying to make the same thing happen for adults.
You've been coming to St. Vincent over a period of years. In fact, you mentioned, I can't remember if you said on camera or off camera, but you've been coming here for over 15 years, I think, even before the World Pediatric Project. And you've been visiting the hospital, you've been working at the hospital. Just soliciting some general comments in terms of where the hospital is at now, in the level of service, the state of the physical environs. What are your general impressions?
My general impressions are that we really need to look at each part of the hospital and see what we can do easily to make it better, and then have a general concept of whether that facility is the one for the future, or whether there needs to be another facility somewhere else. And again, I certainly am not the one to know enough to be able to say that. What I do notice that it seems that it's a very busy surgical operating theater, and we've been coming for 15 years, as you say, and even on the week that we're here and we're occupying 2 of the 3 rooms, almost all day long there's that 3rd room being used for emergencies, and we have started bringing extra people to help so that we don't encumber the system so much. So World Pediatric Project, we have a designated theater that we're going to help outfit in order to have that dedicated to us so that we don't inconvenience the local surgeons who have a lot of work to do as well. So certainly being sure that we have an operating theater that is safe and has all the things that they need. I would say that again, getting back to the pediatric ward, that's one thing that's been renovated. We don't need to worry about that.
So that's taken care of.
I understand that, and I didn't have an opportunity to visit, but I understand that the OBGYN area is developing a new operating room to really take some of the busyness, if you will, from the upstairs operating theaters, because often they're emergency C-sections and then the elective surgeries are having to wait. So I think in the analysis, the folks that are in charge that I've spoken with through the years have said that their plan would be to try to deter just that busyness in the OR by having a theater closer to where the need is, where the mothers-to-be are. So I think that's the plan. I know once that's done, then there's in the offing is doing some renovation to those operating room theaters. I think once you do those things and you've got your pediatric wards, then you analyze all the other things. And as long as that facility is doing what it needs to do, then that will be as successful as it can be at that level. And then whether or not funds could be raised in some way to have a newer facility. You know, every time you add on to a facility, such as the hospital here, you create new challenges. Even not getting lost when you're trying to get from one wing to the other,
right.
Which is a minor thing. But I think outpatient works fine. I mean, you get the equipment. I know it's busy. I just think as more and more people understand that they can have health care and that they can come, you just get more and more people who need it and who have problems. And so, of course, sometimes there's a problem with the facility not being big enough in one certain area to accommodate.
And you did mention, you know, the facility is one thing, but the people. And you've worked among the staff here at the hospital, certainly in the pediatrics, but I mean, and you've described how good they are, but if you look outside of the pediatrics, and I'm sure you've had a chance to observe, what would be your general comments about our staff here at the hospital?
I think they're phenomenal.
Yeah.
We look forward every year to coming into the operating theater and seeing all the familiar faces that we've seen for 15 years. It's just like old home week, and they welcome us. I had two of the staff, the orderlies, come to me today and say, Are you finished with your surgery? I said, I'm finished because the urologist taking over my room tomorrow. And they said, thank you so much for being here. And you know, I'm really kind of shy and reticent, and so I had not gone and met them. But for them to reach out to me and say, thank you for what you do, this means so much, that means a lot. But we see the same people year after year. And the people that operated with me this week, the nurses, they love to do ophthalmology. They know what they're doing well. They are helpful. They try to make our days efficient so we can do more and more cases because we're here for a finite period of time. The sister who was once in charge of the OR is now in charge of pediatrics, so I got to see her again. And they're just phenomenal people. They do good work. They want to do well. The recovery room nurses are wonderful. I'm saying the same thing about all of them. I certainly don't work in all the wards and this and that, but every single person that I come in contact with, they've been there for a long time. And I think that speaks for itself, the longevity of they like their job, they stay there, they do good work. So
you get a sense that there is a good or just mediocre work ethic at the hospital?
I think it's a good work ethic.
Yes.
It's certainly when we come, we can tell that they are trying everything they can do to help us do as many cases and see as many children and have it as organized as it can be. And it's amazing really how many people it takes to really make this thing run. I mean, Sister King was with us all week, her assistant Lisa Ann, Dr. Dada was there, and it just takes a team, a collaborative effort from everyone, and it makes it work. And I'm sure when we come, it's just everybody's working hard to make it work, and then when we go, they maybe can take a breath or two. But we bring 11 teams here, so at least once a month, there's a lot of activity going on.
Yes. We're going to hold it there to end our third segment. When we come back, we would look at specifically the actual operations that you've been doing, if you want to highlight certain cases necessarily. And I want to ask you a bit about where next this World Pediatric Program is going. Okay. What are your plans for expansion, if there are any? So when we come back for that final segment.
Okay.
You're watching Unrendered on IKTV. When we come back from the break, we'll be into our final segment.